Thank you, Mr. Speaker. With your permission, I'd like to begin with a point of personal privilege. As most of you know, our Speaker has just returned to this country after a distinguished tour of duty serving with the U.S. Navy in Afghanistan. He was one of 3 anesthesiologists at the NATO Medical Unit at Kandahar Airport. Naturally, we're all very proud of Dr. Ehrenfeld, and we're glad that he's safely back home. Last October, near the start of his tour, the Board of Trustees voted to extend a commendation to Dr. Ehrenfeld for his service. He received a replica of this last fall, but that does not seem sufficient to recognize what he did for our country and for our soldiers. So this morning, now that he's home, we would like to present him with a framed version of that commendation, of our commendation. My friends, fellow delegates, and invited guests, as we near the end of another eventful year for us and for our medical society, I'd like to bring you up to date on some important issues that we've been working on during the past few months. The first and most important issue I want to celebrate is the repeal, finally, of the SGR Medicare payment formula. It was an incredible accomplishment. This was the House of Medicine at its best. For more than 17 years, physicians worked patiently, passionately, and powerfully to reverse a law that everyone knew was a bad idea almost from the time it took effect. To remind us of how much time has passed since the passage of the SGR law, in 1997, a gallon of gasoline cost $1.23. A first-class postage stamp was 32 cents. The median price of an American home was $176,000. The top television show was Seinfeld, and Bill Clinton was president. All of these things have changed, but the Medicare formula did not, even though most reasonable people on both sides of the aisle agreed that it had to go. I don't have the time or the energy to go through every step of how we finally prevailed. But I do want to say something about why it all worked out. It was because of the deep commitment of the physicians of Massachusetts, the resilience of our colleagues across the country, and the dedication of hundreds of dedicated staff in all 50 states, including our own people here in Massachusetts. They worked tirelessly even when there seemed to be little hope. To all of you, we thank you so very much. State advocacy. In our own state, we have a collection of important accomplishments and a list of urgent issues that still require attention. First, let's talk about the accomplishments. Last year, when Dr. Dunlap spoke to you at this session, we were still working on 2 state initiatives that worried many of us. The proposal to tie a strict meaningful use standard to our licensure requirements, and proposals to expand the online prescription monitoring program in such a way that it would impede the practice of medicine. I'm happy to tell you that the final meaningful use regulations are reasonable and will not deprive thousands of physicians of their licenses. That may sound alarmist to some, but in fact, it was not. As originally drafted, there was literally no way for thousands of physicians to comply with the requirement. The proposal was poorly researched and hastily drafted. It never had a public hearing and was approved at the 11th hour without debate. It took 2 years of hard work to fix things, but thanks to the members of the Board of Registration in Medicine, we now have a set of rules that fulfill the law's purpose without creating chaos in the healthcare system. Congratulations to our government staff, the Committee on Legislation, and the many past presidents who worked so hard to make this happen. The second area of accomplishment was during last year's legislative debate over heroin epidemic. One proposal was to expand the online prescription monitoring program. The PMP has been around for more than 20 years, but it has never been very effective in warning prescribers about problematic drug-seeking behavior, and it's also never been a good public health research tool. Thanks to our advocacy, the PNP expansion was limited to first-time prescriptions of Schedule II and III opioids and benzodiazepines. Office staff and other designated associates may also access the database on behalf of physicians, which also reduces the administrative burden of this requirement. The PMP still poses many challenges, most of which are technical in origin. But these can be addressed, and we are having productive conversations with the Department of Public Health to deal with those challenges. That's all good news. But with opioid overdoses still occurring throughout the Commonwealth in increasing numbers, our elected officials are still looking for answers. Just yesterday, the Attorney General and the Governor of Massachusetts spent more than an hour with your presidential officers and senior staff. We had an intense and very serious conversation about this issue. Their urgency cannot be overstated. More than once they asked us, "What can we do today?" We want to help them find the answers, but we must also ensure that patients who legitimately need pain medications are not harmed by excessive regulation and legislation, which remains at risk. We have been arguing that opioid policy must be rooted in evidence, not anecdote. Personal stories may stir the soul, but they cannot substitute for a thoughtful, evidence-based approach to the problem. When most prescription drug abuse starts with stolen or diverted medications, does it make any sense to punish patients by making it harder for them to get their treatment that they need? Let's make it clear. We want to help reduce the number of heroin overdoses in the Commonwealth, and physicians have an important role to play in this effort. A lot of good things have been implemented already, especially when the legislature improved patients' access to addiction and recovery services. But we continue to need legislators and regulators' help. We need ready access for our patients to the effective alternatives to opioids for pain management. And the insurers must pay for them at least as readily as they do for prescriptions. We need them to understand why we do what we do, and to fix regulations that lead to what is perceived as overprescribing. We can help those troubled by addiction while standing up for our patients who urgently and sometimes desperately, legitimately need access to pain medication. Practicing medicine by legislation has never been a good idea, and it's certainly not appropriate in this instance. Our role in this public debate has never been more clear. Another area of unfinished business is the growing protest over the maintenance of certification requirements for many specialty boards. Physicians must stay up to date on the evolving science, and we have a responsibility to provide the public with assurances that this is happening. But this accountability process must be rational and reasonable. Here, the collective voice of physicians across the country is making a difference. More than 20,000 physicians have signed petitions calling for changes in the MOC process. Their anger is palpable, but evidence, again, is making the difference. The ABIM has already taken a step back to reassess, and there is pressure on other boards to do the same. We recently met with colleagues from state medical societies and specialty societies from around the country to discuss this issue. It's clear to me that coordinated action by the AMA, state and specialty societies represent our best opportunity to improve the situation. As a member of the AMA's Council on Medical Education, you can be assured that I will do everything I can to make it right. We must also work here in Massachusetts to stop the growing trend to throw a CME requirement at every problem in medicine. These requirements have multiplied over the last decade, and they don't necessarily solve any problems. This is another area where the collective voice of physicians can change things for the better. And that is where your work this weekend is important. Your deliberations today in reference committees and Saturday at the House session set the course for this medical society. You define the agenda and set the priorities. Your work here matters, and I look forward to seeing what the next few days will bring. Thank you for your attention. Mr. Speaker, this concludes my report.